Good evening, guys. I have a new discussion for you. Study review overview. Reimagining falls risk 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 assessment in primary care for older adults, guys. Here we go. This study centers on evaluating a newly developed user-centered design driven factual fall risk assessment tool, or FRAT, called Fall Analysis 2.0. Valinizes and loss of independence among older adults, yet traditional FRATs often fail to be fully implemented in primary care due to usability issues, time constraints, and lack of clinicians' engagement. This research tackles those barriers head on by redesigning the tool with direct input from both clinicians and older adult users. Purpose and innovation. The primary aim was to assess whether a FRAT built using UCD principles could outperform standard care in terms of both implementation, how well and consistently it's used, and effectiveness, how thoroughly it identifies and addresses individual fall risk factors. The rationale is clear. If clinicians find the tool intrusive and older adults feel engaged, the likelihood of consistent, high quality assessments increases, potentially reducing fall related harm. Co-design and development process. Fall Analysis 2.0 was crafted through a rigorous participatory design process. Researchers employed UCD techniques such as persona development, interactive prototyping, and behavioral theory frameworks to ensure the tool was not only clinically robust but also practical and user-friendly. The result was a digital FRAT tailored for real-world use in primary care, with streamlined workflows, decision support, and prompts that align with how clinicians actually practice. Study design, effectiveness, implementation, hybrid. The trial used a randomized effectiveness implementation design, a hybrid model that evaluates both clinical outcomes and implementation matrix. Simultaneously, this approach allowed researchers to measure not just whether the tool worked, but how well it was adopted, what barriers emerged, and how users experienced it. Matrix included assessment, completion rates, fidelity to the protocol, clinician satisfaction, and perceived usefulness. Key findings and broader implications. Clinicians using Fall Analysis 2.0 completed significantly more comprehensive multifunctional assessments compared to those delivering usual care. The tool improved implementation fidelity, reduced missed risk factors, and enhanced user experience. These results underscore the power of combining UCD with behavioral science to drive adoption of complex interventions in routine care. More broadly, the study offers a compelling model for redesigning clinical tools. Start the end users, build interactively, and evaluate both outcomes and uptake for aging populations. This means more personalized, proactive care, and for health systems, it signals a path toward scalable, equity-driven innovation. Okay, guys, so that's it for tonight. I'll be on tomorrow for shows. For now, Gator Wellness, take care, folks.